Okay, starting the webinar in 5, 4, 3, 2, 1. Hello, and thank you for everyone who is joining at this webinar. We will wait a few minutes as we are just giving time for participants to enter the room. But thank you so much for joining. Again, welcome to everyone who is tuning in to this webinar right now, either through live stream or here in the webinar itself. We are just allowing some time for participants to come in before we officially start the webinar. Thank you so much for joining us. For those who just came in, thank you again. We're just waiting for a few minutes before we begin to allow participants to come in. Thank you so much for joining us. All right, it is now the top of the hour, so I think we can officially begin our webinar. So welcome everyone. Thank you for joining us today for the virtual roundtable event, Nutrition for Health, Not Just for Growth, an official side event of the Nutrition for Growth Summit. This is co-hosted by NCD Alliance, Resolve to Save Lives, American Heart Association, World Obesity Federation, Health and Global Policy Institute, the George Institute for Global Health, and AstraZeneca. I'm Patrick, and I will be your technical facilitator today. For assistance, please use the chat function to message anyone with the title Technical Facilitator in their name. Before we get started, I have a few technical notes to explain. If you would like to contribute a perspective or thought, please use the chat function. If you would like to post a question, please do so in the Q&A box. Spanish, French, and Japanese language simultaneous interpretation is available during the session. The feature has already been activated and is available by clicking the interpretation button at the bottom of your screen, where you can select the language that you would like to hear. Please also note that the session is being recorded for documentation purposes. One more time, for those of you who just joined us, welcome, and we thank you for attending the event today. I will now pass the floor to Ms. Lucy Westerman, Policy and Campaigns Manager of the NCD Alliance. Ms. Lucy, the floor is yours.
Well, good morning, good afternoon, and good evening to everyone who is on the line. And thank you so much for joining us today. As Patrick said, I'm Lucy Westerman. I'm Policy and Campaigns Manager at the NCD Alliance, and I'm your host for today's event. And I'm really delighted to have you here. On behalf of Resolve to Save Lives, the American Heart Association, World Obesity Federation, Health and Global Policy Institute in Japan, the George Institute for Global Health and AstraZeneca, and the NCD Alliance, I'm really proud to welcome you to Nutrition for Health, Not Just for Growth. This is an official side event of the upcoming Nutrition for Growth Summit, which will be hosted from the 7th to the 8th of December by the government of Japan. For today's event, we've convened voices from across countries, time zones, expertise, and interests. And we all have a common commitment to promoting healthier diets for all people everywhere. And in turn, to helping promote and prevent diet-related NCDs. You'll be hearing from very inspiring speakers with diverse perspectives and insights into the solutions and the opportunities that we have to improve diets for all people. Before I introduce our esteemed speakers and the first panel, I'd like to quickly reiterate those Zoom housekeeping items. We will include some opening remarks from WHO today and closing remarks from FAO. There will be 2 moderated panels, including representatives of civil society, academia, and government. And time permitting, we will hopefully have some questions and answers as well. And we will conclude with the launch of an inspiring brief video that is the first in a series showcasing leaders in NCD prevention. At the bottom of your screens, you'll find a Q&A box. Please use this feature to answer any questions to ask any questions that you have, and a selection will be put to our panelists, time permitting. And panelists may also choose to respond to questions directly by typing responses into the Q&A function. Just a reminder, to increase accessibility of the event, translation is available in English, French, Spanish, and Japanese. You can switch between the languages using the globe icon or the letters at the bottom of your screen. We encourage you to amplify what you hear on social media. This would be using 2 hashtags, hashtag N4G Summit 2021 and hashtag Act on NCDs. And you may like to use the Twitter handles that will be listed on the cover slides for each of the speakers. It's certainly our hope today's event leaves you with a much stronger sense that investing in and prioritising solutions to promote healthy diets can and must be a part of all decisions relating to nutrition and the new smart commitments that come out of the Nutrition for Growth Summit. So to begin, I won't dilly-dally any longer. I'd like to introduce Dr. Naoko Yamamoto. Dr. Yamamoto is the Assistant Director General of UHC Healthier Populations at the World Health Organization. Dr. Yamamoto, many thanks for joining us today during what must be a very busy time for you in the Healthier Populations Division, and particularly from your role as Chair of UN Nutrition. It's in the final weeks leading up to the Nutrition for Growth Summit. It must be very hectic. I'd love if you could share with us and the audience a little more about the World Health Organization and how you see the Nutrition for Growth Summit as an important milestone to achieving health for all, including reducing NCDs. Thank you.
Thank you, Lucy, and also thank you, Patrick. And hello, dear colleagues and friends. Thank you for this invitation. I'm very happy to join. At WHO, we are very pleased with the title of this event, Nutrition for Health. Indeed, without good nutrition, there is no good health and well-being. This is clear at the Food System Summit and COP26, and it will be also at the Nutrition for Growth N4G Summit. Health for all needs to be at the center of what we do. The COVID-19 pandemic has made this truth even more evident. It is certainly smart to to invest in safe, healthy, and sustainable food systems as well as health systems. Yet, unhealthy diet, malnutrition, and diet-related non-communicable diseases are among the top risk factors for the global burden of disease. And current food systems are driving climate change and environmental degradation. The coexistence of the undernutrition, micronutrient deficiency, overweight and obesity, and diet-related NCDs is evident at the population, community, household, and even individual level. This creates a double or triple burden and obstacle for achieving healthier population. Adequate food and clean, healthy, and sustainable environments are an issue of human rights. Protecting human rights, tackling inequities, and removing barriers to access safe and healthy diet is critical to transforming our food and health systems. WHO is continuously strengthening the guidance on improving food environments and promoting safe and healthy diet, including infant and young child nutrition and breastfeeding. We ensure that our guidance and implementation tools are firmly based on evidence and science and relevant to member states and the global community. Our work includes dietary guidance across life course for policy actions to improve food environments. This comprises reformulation of the food products through reducing sodium and sugar contents and eliminating industrially produced trans fat. It's also addressing restricting marketing foods and non-alcohol beverages to children, as well as implementing nutrition labeling in alignment with Codex guidelines. In terms of the fiscal measures, it comprises taxation of sugar sweetened beverages and subsidizing healthier food products. It taxes public food procurement policy and services, including government offices, hospitals, or schools. And last not least, it also includes fortification of food with minerals and vitamins. In 2022, WHO will updating the best buy interventions for preventing and control NCDs, which were developed in 2013 and updated in 2017. We continue to advocate for the support the implementation of these policies. We have seen development in the implementation of the International Code of Marketing of Breast Milk Substitutes and also the establishment of the best practice policy for trans fat elimination and fiscal policy. Dear colleagues, we are at the midpoint of the UN Decade of Action on Nutrition. With 4 more years to go, we need N4G, Nutrition for Growth, to increase the momentum and ensure we reach our nutrition commitments, goals, and targets. Essential nutrition action have to be mainstreamed in health systems and food systems with multi-sectorial approaches. We also need to support civil society organizations to help us with implementation and hold us accountable to ensure we follow our moral compass. I hope this side event strengthens all our engagement toward the N4G Summit and our fight to end malnutrition in all its forms. Thank you again for joining this event and looking forward to discuss with you, all of you. I thank you. Back to moderator Lucy.
Thank you so much, Dr. Naoko, and particularly for highlighting many of what the NCD community knows as best buys and other recommended measures for NCDs. These are things we know works, but aren't implemented nearly as much as they need to be. And we're really pleased to work so closely with WHO and look forward to yet another, what sounds to be exciting year for both global governance of nutrition and also assistance in supporting governments to implement actions for healthy diets. So now let me turn to our first panel. We're going to start with some voices from civil society in particular, who will share what their actions are themselves and also their calls to action, reiterating that point that Dr. Yamamoto made around the importance of working with civil society. I'd like to begin with a young leader from NCD Child, Dr. Shakira Chunara. We saw during the Food Systems Summit, Dr. Chunara, that one of the strongest voices to speak up about the problems with our food systems and what needed to be fixed was a powerful youth movement that you are speaking on behalf of today. And youth have spoken loud and clear about priorities for fixing the food system. Dr. Chunara, can you tell us a bit more about what young people are calling for and what tools are available to help global leaders to take action in line with youth recommendations?
Lucy, firstly, it's a pleasure to see you more directly online, and it's excellent to check in. Based in Johannesburg, South Africa, for those who are listening in. You know, as I sort of approach the question that Lucy is asking, there were a couple of things which come to mind. And the first thing is that we don't have a strong youth movement, and there are pockets of different youth advocates who are pushing for different issues. And I think it's quite important to come together under the banner, for example, of NCD Child, to advocate holistically on these issues. And a couple of points which I'll speak through today is not really anything new, but I think it's important to reiterate and then point to some of the gaps that we can consider as well. So the previous speaker had spoken a little bit about the importance of breastfeeding, childhood, etc. And I think that's the good starting point. So we have a range of best buys, but are these best buys targeted to specific populations? And how do we start to target specific populations? I think that's challenge number one. And looking at early childhood development, that's really when one is passive in a way, although one does see young children, for example, state their food preferences. But within that environment, how do we begin to shape young people's preferences in choice for healthier food? That being said, it's if one has the luxury of doing so. If one doesn't have the luxury of doing so, and working with many orphanages across the country, across the country and the African continent, for example, what we see is what's fed to orphans is usually preserved canned food or preserved dairy food, for example. And so the lowest echelon in society, and as much as we don't want to call it that, the reality is what's their nutrition. So that early childhood is increasingly important. And breaking up the population-based / life cycle approach, we also need to, for example, consider the adolescent phase. And that's when choice starts to feature a lot more. But we also see the disease burden increasing. And by disease burden, I mean the stress and anxiety of being overweight, for example, and also bulimia, anorexia, the mental health issues, which are so intersectional with that adolescent phase. And so the best buyers need to really be tailored to these different approaches. And we see countries across the world pushing legislation on marketing for children. That's important. That needs to happen. Again, our biggest opponents, not saying anything new, is industry and profits. And so I think that's a sum up of where our problems are. Moving on to adults, and I think this is throughout the life cycle, is how do we build food consciousness? And I myself, as a public health practitioner, had not been food conscious until I joined an obesity project, for example. Being a consumer, buying an item, but not having a food label on means that you don't really digest the information. We don't really know what we're eating. And industry doesn't want us to know what we're eating because it tastes good. We're now eating for pleasure, for social engagement, those of us who, of course, have the privilege, but we're not eating for nutrition. So that's it in a nutshell, if I had to talk about where the best buys need to focus, etc. What can we learn from other sectors? And I think this is also important, coming down to that individual level. Working within the HIV space, for example, we're looking at knowledge, attitudes, and practices, the KAP model. How do we start to implement that and understand that in terms of the different population groups? And that's where we will also see that issues such as school environments are highly important, marketing, etc., influences these decisions. What best buy are we missing that would be incredible to advocate on today? And that's food wastage. Just in South Africa alone, for example, a study showed that we had 10 million tons of food which was wasted last year or / this year. So that's a bigger global question. Why are we not focusing on food wastage within this current sort of movement? And how do we put that high on the agenda? It's an important gap and it needs to be addressed. The final one is the intersectionality. And we can't look at things in silos. So even the issue of nutrition and food has such a bearing. And it has a bearing on mental health. Think about it. If one is unable to afford food, if one is stressing about food, that's important. Also linked to body positivity, for example. So I'll stop there for now, but I hope it's some food for thought and no pun intended.
Thank you so much, Dr. Toner. And I suspect that there was a pun intended there. I think we all play on the food entendres when we can. They're very important points you make around the links between undernutrition and NCDs and taking a holistic, coherent approach, integrating into other spaces and looking at the life course to nourishing from birth all the way through to end of life care. And I think it was really poignant that you drew attention to food waste and the problems there, particularly given we've just had COP26 ending. So thank you so much for your contributions, and I'm sure we'll come back with further questions later. Next up, I'd like to introduce Nicole Eade from Resolve to Save Lives. It's great to have you join us today, Nicole, and also as co-hosts to our event. Resolve to Save Lives has a really strong track record in terms of supporting country level efforts to implement sodium reduction, industrial trans fat elimination, front of pack labelling, healthy procurement policies, and so many more interventions. Nicole, it would be really wonderful to hear from you why reformulation is important to improve nutrition and how procurement integrating higher standards for food can be both a double duty action and a smart solution to improving nutrition for all. Thanks, Nicole.
Thank you, Lucy. And a special thank you to all of our co-organizers and a warm welcome to all of the participants of this event. Resolve to Save Lives works to end preventable death from cardiovascular disease by providing assistance and targeted investment to governments and civil society to eliminate artificial trans fat from the global food supply and to reduce sodium intake in countries around the world. Though our work in nutrition at Resolve targets these two specific goals, the double burden of malnutrition provides us a unique opportunity to think more broadly about how we work to improve the overall nutritional quality of diets around the world. So I'd like to share today about some of the effective, cost-effective, and scalable policy solutions that Resolve and our partners are supporting in countries to transform the way the world produces, consumes, and thinks about food. And first is healthy public food procurement, which is a clear and logical way to use public funds to promote healthy diets. As laid out in the WHO Action Framework on Healthy Food Procurement and Service Policies, governments can establish policies to ensure that food and beverages served and sold in public settings follow core principles of healthy diets, including limits to sugar, salt, saturated and trans fats, as well as increased consumption of whole grains, vegetables, fruits, nuts, pulses, and ensuring that safe drinking water is available for free. Another important policy solution is front of package labeling. Increasingly, prepackaged foods and beverages are readily available virtually everywhere. And labels on the front of packages are an effective and efficient means of communicating with consumers at the point of purchase. Clear and simple warning labels, as demonstrated now by a growing number of countries, help consumers identify unhealthy foods and discourage excess consumption of foods with little or no nutritional value. Further, they can stimulate reformulation, and they can easily be combined with restrictions to ensure these unhealthy products are not marketed to children and youth. Resolve also works on food reformulation in two main ways. First, implementing policies to eliminate artificial trans fatty acids, which is economically, politically, and technically feasible and saves lives at virtually no cost to governments or consumers. To do this, countries implement a proven best practice policy as recommended by WHO, which places mandatory limits on the amount of trans fat permitted in foods. 45 countries have done this to date, protecting almost 40% of the global population. And the WHO Replace Action Package provides a roadmap for governments and other stakeholders to get there. Earlier this year, the WHO released global sodium benchmarks to guide the reformulation of foods to contain less sodium. These benchmarks, as well as the recently released targets set by the PAHO region, can be used by countries to set sodium reduction targets for packaged food to gradually reduce sodium over time in their food supply. And finally, I'd like to talk about fiscal policy interventions. There is strong evidence for the effectiveness of sugar-sweetened beverage taxation. And while still limited, there's growing evidence suggesting that taxation of foods high in salt, sugar, and fat can improve people's diets. Interest has been increasing, and specifically around using nutrient profiling models as a basis for fiscal policies. Subsidies for foods, for healthy foods like fresh fruits and vegetables, can be effective in increasing their consumption, and these can be used in combination with unhealthy food taxes to increase health gains. And now in the current COVID-19 pandemic, with increased fiscal constraints on governments, these unhealthy food taxes can provide an immediate source of revenue while also reducing the incidence of NCDs, thus reducing the likelihood of serious COVID-19 complications. So while progress is being made in each of these areas, most countries are unfortunately far from reaching global targets and reducing the burden from NCDs. Thus, we urge countries and advocates to urgently prioritize funding and action to promote healthy diets. We call on governments to make smart commitments to take on multi-component approaches, combining a variety of policy measures, along with monitoring and evaluation plans and convening a variety of stakeholders across the food system. We hope to see you at the upcoming Nutrition for Growth Summit and look forward to seeing your country's commitments to promote healthier food systems. Thank you, and back to you, Lucy.
Thanks so much, Nicole. I think you've made some really strong cases for higher standards of food procurement, better warning labels on food about what we're actually eating, good reformulation that makes sense to remove the more harmful parts of foods, and also obviously fiscal policies, which can have huge life-saving potential. And obviously there's some very handy tools out there that you explained, and I did see popping up in the chat some posts from Lena May at WHO who's added some links. So please go and check them out if you're looking for more information about how to implement these policies, and do add any questions you have for Nicole in the Q&A. Next up, I'd like to introduce Cheryl Toner. And Cheryl, given the work of the American Heart Association to improve diets, both in the USA and globally, it's really great to have you join us today, co-hosting this event as well. One of the most important issues that you address at the American Heart Association is food insecurity. Although obviously even hearing the conversation today and the multiple forms of malnutrition that can coexist in individuals and communities, perhaps nutrition insecurity is a more appropriate term. Can you share with us a bit more about your priorities and your recommendations for tackling nutrition insecurity?
Yes, thank you so much, Lucy, and thanks to everyone for the having us here today. We're very pleased to be partnering with you on this event. And indeed, you mentioned the importance of thinking about nutrition security rather than simply food security. Certainly, food security is critical to address, but if we have calories without good quality nutrition, then we still have the same increased incidence of chronic disease that we have with insufficient food. The American Heart Association's mission is to be a relentless force for a world of longer, healthier lives. And so therefore, we are a staunch supporter of policy, systems, and environmental changes that advance equitable access to nutritious, affordable foods and remove barriers to healthful eating. And we do this through many different means, such as advocating at the federal, state, and local levels, providing consumers with tools for better nutrition, engaging food systems industries in dialogue with strong guardrails in place to improve healthy food availability, and partnering in communities to implement new systems. I'd like to share a few specific areas that we're working on today as examples. The first area of priority is AHA's advocacy with our partners for high quality early care and education programs and supporting childcare providers as they work to offer healthy food. We have long advocated for supported implementation of and protected science-based nutrition standards for the National School Meals Program, which serves pre-kindergarten through 12th grade students. And we're advocating for increased access to the National School Meals Program through community eligibility programs. During the pandemic as well, we advocated for creation of pandemic electronic benefits transfer, also known as pandemic EBT. When schools were closed due to the COVID-19 pandemic, children who would have received free or reduced price meals were instead eligible to receive temporary emergency nutrition benefits loaded onto this EBT card that was used like credit cards to purchase food. We're also advocating for strong nutrition standards and increased access to the Child and Adult Care Food Program, which provides reimbursements for nutritious meals and snacks to eligible children and adults who are enrolled for care at participating centers. A second area of priority is our pursuit of funding for financial incentives that enable people to purchase healthy foods as part of our government's nutrition assistance programs. The AHA advocated for increased benefits through the Supplemental Nutrition Assistance Program, or SNAP, the program that provides financial benefits to supplement the food budget of needy families so they can purchase enough food to feed their families. The Thrifty Food Plan is used to calculate SNAP benefits and was recently updated, resulting in a long overdue increase in SNAP benefits this year. The AHA was instrumental in the creation and expansion of the Gus Schumacher Nutrition Incentive Program, known as GusNIP, through which the Department of Agriculture provides grant funding to nonprofit organizations and government agencies to conduct and evaluate projects that incentivize the purchase of fruits and vegetables by low-income individuals. And finally, the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC, provides supplemental foods, healthcare referrals, and nutrition education for low-income mothers, infants, and children up to 5 years of age. We advocate for strong WIC nutrition standards and increasing the cash value of benefits for the purchase of fruits and vegetables through WIC. A third priority area where we are investing in hyperlocal community-led solutions to addressing targeted community-level health equity barriers. We do this by investing in qualified organizations that operate in under-resourced communities to implement sustainable solutions to address the social determinants of health. Our Voices for Healthy Kids funds community-based issue campaigns to make each day healthier for all children, and our community impact staff across the U.S. advocate for and support implementation of policy, systems, and environmental changes that have been identified and prioritized by those communities. And finally, I'd like to share that on the global level, the American Heart Association is pleased to be serving with the Alliance for Biodiversity and CIAT, the International Center for Tropical Agriculture, as co-secretariat of the Periodic Table of Food Initiative. It's a global multi-sectoral collaborative effort that aims to standardize and democratize methods to more completely characterize the components of food within the context of how they are produced. I hope that this broad overview of our approaches to advancing nutrition security in particular is in support of the Sustainable Development Goals is helpful. Thank you.
Thank you so much, Cheryl. And my goodness, American Heart Association is busy. I think we can all subscribe to this goal of longer, healthier lives for all, for certain. And I think what you've pointed out is several initiatives in their own right, but also opportunities to work across different sectors. I heard you mention agriculture, education, social care, different levels of government. So I think while we look at the policies that need to be implemented, we also need to look at who has a role to play in implementing those policies and potential allies and collaborators. And perhaps people may have a question for you around how you manage those relationships and negotiating these different sectors. Thank you so much for your time. Next up, we have Dr. Alaphia Samuels. And Dr. Samuels, it's lovely to have you here. Thank you for joining us. Your career spans medicine, research, public health, government in the Health Ministry of Jamaica. You bring diverse perspectives to the discussion today, and we really appreciate your contribution. Today, you're with us wearing your hat as co-chair of the Policy and Prevention Committee at the World Obesity Federation, who are also co-hosts of this event. And so from your viewpoint, we'd love to hear what you think the smartest commitments are that civil society organisations can make to improve healthy diets, and in particular, what opportunities there are for calling for greater investment in NCDs and obesity prevention. Thanks.
Thank you very much, and greatly appreciate this opportunity to share with you. I'm talking to you this morning from wonderful Jamaica in the Caribbean. We are one of 58 small island developing states in the world. And I mentioned that first because small island developing states are very vulnerable to both NCD risk factors and NCDs, with some of the highest rates of obesity and premature death in the world. And in small island developing states, although many of us are food and nutrition, thank you, food and nutrition secure in that there's enough money mostly to buy food, we lack food and nutrition sovereignty. What do I mean by that? Small island states by necessity have to import a lot of their foods. And the World Trade Organization requires free trade, which means that there's a lot of unhealthy processed foods that are imported into small island states. And this is a major problem. And civil society needs to engage, and has been, especially in the Caribbean, been engaging with government and other agencies to address some of these challenges. So we want to look at some of the interventions and suggestions that are around civil society and healthy diets. So one thing that we need to do, although some of us don't want to do it, that is to engage with the food industry. There is a wide variety of players in the food industry, and we can start with what we call the friendly food industry. There are commercial people making profit from selling healthy foods. There are commercial people who are willing to engage with us. I give you an example. In Barbados, we had a big company. One of the members was on the NCD commission, the multi-sectoral NCD commission. And based on the discussions in that commission, he went and reduced the amount of salt in the bread that he sold. So there are possibilities. We also have been working with the Healthy Caribbean Coalition and Heart and Stroke Foundation and other organizations around the question of marketing, especially to children. And I am afraid that I have to tell you all that there is an island in the Caribbean where fast food is branding classrooms. So the children, and these are primary school children, are in the classroom. They see the logo for the fast food restaurant all day because it's on the book covers, it's on the pencil case, the calendar, everything. And it has been a struggle along with civil society to get the Ministry of Education in that country to say that this is against the advice of WHO that clearly states there should be no marketing of unhealthy food to children, and especially not in their classroom. So that's a big thing that we need to be dealing with. Front of package labels was mentioned before. We have been engaging, both civil society, the university, and others have been engaging with CARICOM. So in the Caribbean, because we are these multiple small island independent countries, there's a very robust regional organization called the Caribbean Community. And there's a lot of policy work that goes on at that level. And so recently we supported advocating for graphic front of package labels. We wanted to use the ones that were piloted in Chile, the black hexagons. Industry in the region was successful in shutting that down. And they did all their different maneuvers. And when the vote came, some of the countries voted against the front of package label. So it's a big problem. I understand, I say work with them, but at the same time, we understand, you know, when you sup with the devil, you use a long spoon, but you still have to sit down to eat with them. We also have been working through the CARICOM process, looking at trans fat that was mentioned earlier too, because in the Caribbean, we are very close to North America. So all the trans fat that's now banned in North America is being sold in the Caribbean. And how do we know this? We know this because very recently, Jamaica acquired the capacity for the first time to monitor fat, trans fat, and salt in foods. And so now we can validate the labels. And what we found recently is that half of the foods in Jamaica that have trans fat are labeled trans fat free. So the labels are misleading. So there's a lot of work that needs to be done. So let me just quickly now go on to the issue of financing for NCDs. Reality check, people. Okay, so, you know, folks are saying, oh, you know, we got so much money for HIV. Why can't we get money for NCDs? The reality is that we, in fact, are not going to be getting that money for NCDs because it's not in the financial best interest of high-income countries. They make profit from selling the foods that cause NCDs, and they can't catch diabetes from me if I go to New York. They could catch HIV from me. So there's no financial motivation really for them to help finance NCDs. What we need to do is to tax unhealthy food, tobacco, alcohol, and use that money for NCD prevention. And that's, of course, a win-win because it will also reduce consumption. So thank you all very much. And I turn back over to the moderators. Thank you.
Dr. Samuels, it sounds like a very enlightened perspective you've brought to us today, and obviously highlighting those significant challenges and also some of the opportunities, given the food industry has such an important role to play in the ultra-processed foods that are contributing so much to poor health. I think we've heard of schools being a key setting for children. I think that many of us on this call could agree with one powerful potential commitment that could be put to leaders at the Food Systems Summit would be to simply ban junk food marketing and sponsorship in and around schools. It seems such an obvious one, and you've highlighted it and others have, that schools should be health promoting. So I think we may come more to discussing schools a little bit later. But in the meantime, I'm going to hand over to Dr. Evie Safridi. And Dr. Safridi, thank you so much for joining our panel today from the George Institute for Global Health, also co-hosts of today's event. And you must be very busily digesting the outcomes of the recent Food Systems Summit, but also the climate COP26 that's completed in Glasgow, and the implications for fixing the food system and addressing all forms of malnutrition in these complex bundles in a sustainable way. What do you see as effective and efficient double duty actions that stakeholders could commit to transform the food system for people and the planet?
Thanks, Lucy, and thanks everyone for joining. So in my talk, I'd like to bring the attention, as Lucy said, to the interconnections between the food system and planetary health. Because what we eat and the way we produce it contributes massively to climate change, from greenhouse gas emissions, fresh water use, land use, and deforestation. But at the same time, climate change impacts the food we eat and our health. So rising temperatures deteriorate crop yield and quality, which can contribute to food insecurity or reduce food diversity. But also something that's often ignored is that diet-related disease increases vulnerability to climate change. So mortality from extreme heat, for example, is higher among people with NCDs. Importantly, environmental harm caused by the food system is mainly driven by consumption in high-income countries, but implications are mainly felt by the most vulnerable in low and middle-income countries. So using the WHO's kind of levels of double duty actions, I wanted to make 3 points on how we can ensure that food policy can protect both planetary and human health while addressing growing inequalities. So first, we need to ensure that current food policy has no unintended consequences to the environment or inequalities. And for this, we need to change our current practice. We need food policy evaluations to not only consider health outcomes, but also look at environmental impacts across different levels and impacts of vulnerable population groups and their intersections. And this should be our go-to approach from now on. We also have the opportunity to adapt existing food policy structures to have dual health and planetary benefit. And I use as an example the nutritional rating systems that are very common from many governments and are used to categorize products, usually into healthy and unhealthy, and they identify which products fall under different regulations. So for example, labeling or marketing restrictions. But those systems tend to be reductionist, they focus on specific nutrients, and we have an opportunity to adapt existing nutritional rating systems into a whole food approach that incorporates environmental impacts. And of course, there are many challenges with that. And we aim to address some of these challenges with our current work with the George Institute. There is a lack of comprehensive information on the environmental impacts of packaged foods, and those constitute the large majority of the food weight, especially in high and middle income countries. We know that meat is like the largest contributor at farm level, but we need higher detail in order to regulate the food system that is mainly comprised of packaged foods. And we need these estimates to be independent and free of corporate interest, because poorly estimated impacts can be used by corporations as marketing techniques to promote foods that are either not as sustainable or that are unhealthy as sustainable options. And finally, another challenge is that some of the mechanisms of dual harm may be complex. So for example, ultra-processed foods are associated with overconsumption, and this is a risk factor both for environmental and planetary health, but this is a bit harder to quantify and use in nutritional rating systems. So finally, a third action that we could do is design new food policies that aim to simultaneously improve both human and planetary health. But for this, we need concentrated food governance. We need policy coherence across different sectors, from health and social care to trade and agriculture, and across different levels, nationally, regionally, and locally. And also, we need to meaningfully involve community members in both policy design and implementation, especially communities such as Indigenous and First Nations peoples who have rich knowledge of local food systems, and those whose voices tend to go unheard, like youth, people living with disability, and other communities experiencing marginalization. So with COP26 wrapping up in Glasgow last week, we saw that actions are not taken as urgently as we need, and that the food system and the intersections between climate change and health are not discussed enough. And that's why it's now more urgent than ever to advocate for and prioritize to achieve food interventions that benefit both human and planetary health, and to promote good nutrition as a human right for everyone. So I'll just wrap up here and go back to Lucy. But thanks a lot for listening.
Thank you. Thank you so much, Dr. Safridi. And I think what you sort of refer to or allude to is the opportunity for triple duty actions, these synergistic opportunities to benefit multiple forms of malnutrition at the same time as benefiting the planet. And it really sounds like a win-win-win for everybody. I also appreciated your reference to the importance of listening to and meaningfully involving Indigenous and traditional landowners and voices. I think this is often under reflected in policy making, and certainly important to be part of the conversation. So thank you so much for your contribution there. And thank you also to all of our panelists who we've heard from so far. They've certainly presented a very strong evidence case, I would say, for action. I'd like now to turn to our second panel of guests who are representing governments. And these are governments who have been identified as demonstrating somewhat exemplary leadership when it comes to promoting nutrition and healthy diets policies, which will reduce NCDs. Firstly, Ms. Yoko Saito, Welcome to our event today, and thank you for staying up late to share insights from the Health Bureau at the Ministry of Health, Labour and Welfare in Japan. This must be a very busy time for you. With Japan as hosts of this year's Nutrition for Growth Summit, we are sure there are very high hopes that other leaders will also step up to invest in nutrition for all. Japan has a strong nutrition policy track record, for example, among leaders in nutrition education. Ms. Saito, we would love to hear some highlights from your national nutrition policy, which may inspire others to make similar smart commitments at the summit this year. For everyone's information, Ms. Saito will be sharing her presentation in Japanese, so we ask you to please turn to the interpretation mode for your preferred language. Thank you.
紹介いただきましてありがとうございます。厚生労働省の斉藤と申します。また本日はこのような機会をいただきまして関係者の皆様に感謝を申し上げます。私の方からは日本での栄養政策のこれまでの取り組みについてご紹介をさせていただきたいと思います。さて、我が国では戦前戦後の食糧難による低栄養、経済成長に伴う過栄養、さらに近年では栄養不良の二重負荷に対する取り組みも進めており、厚生労働省は日本の栄養政策を中心的に担う省庁として、関係省庁や関係機関と連携をして、栄養改善の取り組みを積極的に推進をしてきました。経済成長に先立って誰一人取り残さない栄養政策を人材とエビデンスの要素を組み合わせた政策をこれまで進めてまいりました。人材とは傷病者や高齢者をはじめとする複雑な栄養課題を抱える対象者の栄養管理を行う人材として管理栄養士制度を創設・要請をしてきました。医療機関、学校、民間企業、高齢者施設、地方自治体などさまざまな施設への管理栄養士の配置が各種法令により規定され、全国の各施設への配置が進められました。また、そうした現場で発生する課題にも専門性を持って管理栄養士がこれまで対応をしてきております。また、栄養政策の策定・改善のプロセスとしましては、科学的なエビデンスとなる調査・研究により明確化した栄養課題の改善に向け、政策を計画、実施、評価、改善する PDCA サイクルを回しながらこれまでの展開を行ってまいっております。我が国の健康栄養政策は国と地方自治体の両輪で推進がされております。現在、健康増進法に基づく健康づくりとして健康日本21第2次を進めており、乳幼児期から高齢期までそれぞれのライフステージにおける心身機能の維持、向上につながる取り組むとともに、生活習慣病の発症、重症化予防について、具体的な通知目標、例えば食塩摂取量の低減ですとか、バランスの良い食事をとること、また、減塩などに取り組む食品企業や飲食店を増加させるといったような目標値を定め、国民健康栄養調査などの調査により毎年モニタリングをしながら国民の健康栄養状態を把握、評価をしております。またこうした運動を推進するにあたりましては、例えば子どもたちの栄養改善については学校保健や学校給食の観点で文部科学省と安全で持続可能かつ健康的な食を推進する食料システムの観点では、農林水産省など関係の省庁と連携しながら取り組みを進めております。さらに、食に関する知識と食を選択する力を習得しながら、健全な食生活を実践することができる国民を増やすために、食育を推進をしています。食育の推進にあたりましても、国、地方自治体による取り組みとともに、地域においては学校、保育所、食品関連事業者、また ボランティアのさまざまな立場の関係者と連携のもと、こうした取り組みを進めております。こうした取り組みを進めるには、エビデンスに基づいた基準やツールの策定が必要であり、厚生労働省では食事摂取基準や食生活指針、フードガイドの策定なども行っております。今後の栄養政策については、活力ある持続可能な社会の実現に向けて、あらゆるステークホルダーと連携し、栄養政策を強化していくことが重要です。そのため、産学官のマルチセクターで連携体制のもと、健康的で持続可能な食環境づくりとして、まずは減塩の取り組みを進めていく予定にしております。本日お話をした具体的な内容につきましては、12月の栄養サミットのイベントでもお示しする予定としております。また、誰一人取り残さない栄養政策のパンフレットでも、英語版、フランス語、スペイン語でこういう形で紹介をしておりますので、ぜひご覧ください。それでは、12月に東京で皆さんにお会いできることを楽しみにしております。ご清聴いただきましてありがとうございます。
Thank you so much, Ms. Saito. That was an excellent overview of what you're doing in Japan already and taking that life course approach from early childhood all the way through to older age. It's so helpful to hear about the cooperation that is needed between the different sectors and how introducing standards for foods, such as with regard to sodium or trans fat content, has helped to improve nutrition quality for everyone. It's excellent to hear about the brochure. Please, if you're able to put the link in the chat, that would help us to make sure that everybody can have a look at that themselves. Thank you so much for your time and all the best with the Nutrition for Growth Summit. I'm sure there'll be many on this call who register straight after the meeting to join it themselves. Next, it's my honour to introduce Michael Alimurin, who's the City Administrator of the Quezon City Government. He was unable to join us today, but he's kindly shared a recorded message which highlights some pretty inspiring leadership of the Quezon City, which has introduced a recent executive order requiring that foods procured in the city meet nutrition criteria that's relevant to preventing NCDs. If we could have that video now, please.
The Quezon City government would like to greet the organizers and participants of today's event, Nutrition for Health, not just for growth. We share the belief that proper nutrition is a necessary ingredient not just for economic growth and development, but also for improving health outcomes and saving lives through the prevention of non-communicable diseases related to unhealthy diets. The Quezon City government procures food for its numerous beneficiaries every day, which include hospitals, offices, rehabilitation and action centers for the youth, daycare centers, feeding programs, and food assistance for disaster-affected families, especially in light of the COVID-19 crisis. To help improve the health and nutrition of the city government's beneficiaries and promote healthy diets, the city government issued Executive Order Number 16, Series of 2021, establishing the Quezon City Healthy Public Food Procurement Policy last July 23. The policy requires all food procured by the city's end users to pass a set of nutrition criteria. The key nutrition guidelines require the diversification of nutrient sources, the inclusion of more fruits and vegetables, the reduction of sodium and sugar, and the elimination of trans fat in all meals and snacks. The policy also includes cluster and institution-specific guidelines for cases which require more calibrated nutrition specifications or exemptions to the key nutrition guidelines. The policy also aims to establish linkages to local food producers to help achieve food security in the city, and promotes research and advocacy programs to explore possible interventions in the food environment outside of the procurement process. The city conducted pilot implementation of the policy in the city-run hospitals and social service institutions from June until July, and the results showed an increase in the serving of healthy foods and a marked decrease in the serving of unhealthy foods. This policy will ensure that food served by the city government to its beneficiaries will continue to be healthy and nutritious. These encouraging results show that the policy can go a long way towards improving health outcomes in our city. The policy can be replicated, and we hope to inspire other local government units to enact their own healthy public food procurement policies. Studies are also being done to scale up the policy nationwide. We also hope that our experience encourages governments around the world to take this small step towards improving the nutritional status of their beneficiaries by ensuring that no public funds are spent on unhealthy food. By ensuring proper nutrition in public food procurement, we invest not just in growth, but in the healthy lives of our people. Thank you.
I'm sure you will agree that this example from Quezon City is actually a really excellent model to look at that municipal level government action, which could inspire other local governments to actually replicate this approach and make their own smart commitments around procurement for the Nutrition for Growth Summit. There's often a perception that it's only federal level governments can make commitments to these fantastic summits, but actually anyone can be involved, and we'd encourage anyone who is on this call or who has a role to play in a small organisation or a smaller level of government to certainly consider doing so. Next up, I would like to pass over to Ms. Sirpa. We're really honoured to have you join us here today, Sirpa, given your role advising the Ministry of Social Affairs and Health in Finland across non-communicable diseases, health promotion, nutrition, and for food policies, and including procurement, which seems to be a bit of a hot topic. Finland's among the first member countries, I believe, that have joined the new Coalition for School Meals that's emerged out of the Food Systems Summit. So it'd be great to hear a little bit more from you about why the government of Finland is prioritising school meals, but also what else you're doing to prioritise nutrition for all.
Thank you, Lucy, and thank you for giving me the opportunity to share some of our experiences in Finland in promoting healthy nutrition. And like many other speakers before me, we are also emphasizing very much cooperation between different sectors and policy coherence. We have been using different policies to tackle malnutrition and improve nutrition, especially in diet-related non-communicable diseases. And for that, we find it's very important to cooperate between different government departments, but also with other stakeholders to influence all sectors of the society to improve nutrition, including not just health, but also education, research, agriculture, trade, economics, and so on. And we are using multiple measures to have greater impact. Our toolbox includes many approaches, such as reformulation of foods, especially to reduce salt and saturated fat, health and nutrition education with cooking skills as a part of formal education to all pupils, including the boys, fiscal policies to subsidize healthy meals, but also taxes on unhealthy products like soft drinks, and labeling of foods and meals to indicate healthier choice, and also warn about high salt levels. So we have had the policy of warning labels also for some decades. We are also encouraging all stakeholders, including food services, private sector, and NGOs, to make smart nutrition commitments as a part of Finland's commitment to sustainable development. This system has been ongoing for 4 years, and we are now currently evaluating it. So there's a lot going on, but today I focus on school meals, which is a powerful policy tool with benefits that can go far beyond nutrition, growth, and health. As many have mentioned here, school meals are usually a part of public procurement, and public procurement of food and food services means using public money on places like childcare centers, schools, nursing homes, hospitals, and other public settings. And in these settings, many people are vulnerable, and healthy food can really make a difference. It can improve well-being and health, as well as educate about preferable choices. But it can also have other benefits, like support sustainable production offer possibilities for employment, and also a market for local economy. Indeed, public procurement for school meals should not be seen as a cost. It's more like an investment for healthier and better future. And we in Finland know it from our own experience. And I'll tell the success story of my country. We actually started giving school meals to all pupils more than 70 years ago, when Finland was still a poor country and undernutrition was very common, especially eastern part of Finland. Money was limited, but we had wise leaders at that time who understood that children are the future. They saw that many children were too hungry to go to school or couldn't concentrate on studying or learning. Provision of simple meals free of charge to all pupils had many beneficial effects. It increased equity and school attendance rates. It improved child health and educational attainment, and it even helped the mothers to find employment outside home. So it was a big success, and the rest is now history. Currently, we have a well-functioning school meal system that offers hot, healthy meal with salad and other side dishes free of charge to all pupils at all grades. The system has developed from initial very simple meals to a very sophisticated system. In addition to dietary guidelines, we have clear nutrition criteria for individual meals and meal components that covers salt, saturated fat, sugar, and dietary fiber. In addition, we have requirement for consumer education, and school meals are a part of official curriculum. So it's really a part of the teaching, not just food. And our latest guidelines include also sustainability that is increasingly important in educating children. So school meals are really a platform for many good things. And we know that school meals are a powerful tool to improve health and well-being in all countries. It has been estimated that in low and middle income countries, every dollar invested in school meals yields $9 back. This is very high return of investment. And it happens because healthy and educated children will be more productive adults. And therefore, Finland has, together with some other countries, been very active in building up a coalition on school meals as a part of UN Food System Summit. And already more than 60 countries have joined in. And official launch of the school meal coalition will be tomorrow. So yeah, I invite you all to join the launch event and also join the coalition. I think that will make a really difference in many countries. And I will tap the address to the place where you can find more information in the chat box. But thank you for your attention.
Thank you so much, Super. It's wonderful to hear. What's that? Every dollar invested returns $9 in low middle income countries and school meals. That's just such a tremendous return. And as you say, not just health, it's also productivity, and it's done in an equitable way. You know, obviously school meals and healthy school meals are not the cost, they are an investment, and we need to look at it that way. So thank you so much for sharing that story, and also how it's evolved over time to be, you know, focusing not just on undernutrition, but also NCD prevention, equity, and also sustainability. So very important. So please do drop the details in the chat, and hopefully multiple people who are following this event will join tomorrow. Turning now across to Ms. Inoshi Sharma, thank you also for joining this event. You bring not only important insights, but also an example inspiring of leadership from your position as the Executive Director at the Food Safety and Standards Authority of India. So this has been mentioned several times, you know, not just through the American Heart Association's contribution by Cheryl, but also others around how nutrition insecurities are challenge that many countries face, but obviously India is one with a really significant burden, a double burden of malnutrition. So can you explain to us a bit more on how you're tackling this challenge, and what measures you're taking to improve the food supply across the population?
Thank you so much. And it's been a big pleasure, listening to everybody. And I feel a lot of efforts which number of countries have today mentioned is something that we are working on. Food is a subject which is, touched upon by a number of ministries and departments in the country. In India, of course, the organization that I belong to, the Food Safety Standards Authority of India, looks after primarily the regulations as well as the licensing and registration of the FPOs and making sure that, the compliances are there. But what we also realized was that, being the second most populous country in the world, having, the triple burden of malnutrition, a growing concern towards the increasing costs because of foodborne illnesses, and the rising incidence of NCDs, almost 60% of the deaths can be attributed to NCDs. What we realized was we need a more holistic approach, and that is exactly why the Eat Right India movement was launched, which is based on the food systems approach, which integrates food safety, public health, nutrition, and environmental sustainability using a mix of regulatory, capacity building approach that goes beyond the traditional mechanisms that we have been using till now. And what is really significant is in this particular approach is that consumers are, of course, advised to have a more balanced diet, eliminate industrial trans fat from their food, reduce the consumption of salt, fat, and sugar. And from the government side, of course, it also involves promoting safety, hygiene, training the food handlers, promoting large-scale fortification, encouraging, the limited use of plastic, stopping the wastage of water during processing. So these are some of the initiatives that have been going on. Now, coming specifically to issues of malnutrition, the FSSA I had recently in 2018, it's not so recent, of course, 3 years have happened. In 2018, provided a regulation whereby 5 staples, which are oil, milk, wheat, rice, and salt, can be fortified with vitamin A, D, iron, B12, and folic acid. And this, of course, has been adopted in most of the food safety net programs across the country, in which food is being provided to children through the midday meal scheme in the schools and at the community level to the pregnant, lactating, and children up to the age of 6 years. So in 2020, of course, the fortification mandate was also extended to cover breakfast cereals, beverages, which is limited to juices, and bakery items such as breads and buns. Again, foods which are not high in salt, fat, and sugar. We also came out with the Safe Food and Balanced Diet regulation last year, which intends to make foods in and around schools healthier. And it places a ban on advertisement of foods which are high in salt, fat, and sugar around the school and in the school. No advertisements, no sponsorships, no scholarships, any kind of promotion is not allowed. We've also got a regulation on the back of the pack labels for detailed information regarding the contents of a particular package. We're also working towards the front of the pack labeling, which hopefully should be in place next year. We've also provided for menu labeling in restaurants so that you just don't have allergens declaration, but also the calories and the content of the food. And then, of course, there are a lot of regulations for health supplements, nutraceuticals, probiotics, prebiotics. A lot of time there are misleading claims and advertisements which are going on. That also needs to be checked. And of course, we are working with a number of other departments and ministries to make sure that people have a more comprehensive idea about what is considered healthy, because a lot of time people think this food is healthy, not realizing, just because you've been having it traditionally, it's not, providing you with all the nutrients which are actually necessary. So with this, of course, we're also working towards the trans fat elimination, and with the WHO recommendation for its elimination by 2023. I mean, I'm very happy to share that by 1st of January 2022, we would be having trans fat limited to only 2%. That means any products, food and food products, oils will not be having more than 2%. So these are some of the activities that we are taking on. I hope I covered everything and that was useful. So over to you, Lucy. Thank you.
Thank you so much, Ms. Sharma. And again, another incredibly inspiring example of what can be done if you have the conviction that it must be done to improve the nutrition of your population. There's so many opportunities and so many levers that you can pull through the standards, through the bans and regulations around schools. And this is something that we're starting to see more and more examples of. And I think we're about to hear of another example. There's some really exciting things in the pipeline, the trans fat elimination coming up. It's really wonderful to hear what India is planning and doing through the food standards regulations. So thank you for sharing, and all the best to you with that. We look forward to hearing more. So now I'm going to pass over to Mr. Julio Cobos. Welcome and thank you so much for joining us. He's a national senator and vice chairman of the Foreign Affairs Commission in the Senate of the government of Argentina. And may I first congratulate you as one of the authors of a very recently passed law on the promotion of healthy eating, which is such an important law and includes a package of several measures, such as front of pack warning labels, marketing restrictions, and also similar restrictions on food products in schools. So these are all to improve the food environment for the Argentine population, and it's likely to be music to the ears of many on this call that you're taking such important and strong actions. You'll be sharing your statement in Spanish, so we ask those tuned in to turn your interpretation to the language you prefer, please. We really appreciate your participation today. We're aware that you've just been in the national legislative election day in Argentina, so thank you for your time. Please, can you describe for us a bit about the highlights of this process you've been through recently and the factors that have helped contribute to achieving this law?
Bueno, muchísimas gracias, un gusto. Gracias por la participación y esta oportunidad. Argentina tiene índices elevados de sobrepeso y obesidad, tanto en su población adulta como también en nuestros chicos, en las personas menores. Así que esta ley que lleva discutiéndose hace más de 5 años, en el momento que iniciamos la presentación y que después se sumó a la discusión proyectos similares de varios legisladores, pudimos acordar como política de consenso, entendiendo que la salud comienza por la alimentación. Y es que en este sentido hemos hecho foco a este proyecto que lo llamamos aquí como ley de etiquetados, a efectos de evidenciar nutrientes críticos, como también excesos en calorías, para que quede a través de octógonos negros con letras blancas, bien perfectamente claro cuando un producto tiene exceso en sodio, exceso en grasas saturadas y totales, exceso en azúcar y exceso en calorías, como yo les decía recientemente. Un proyecto que acaba de ser sancionado hará 20 días y promulgado la semana pasada por parte del Ejecutivo y que tiene varias aristas. Principal, proteger la salud, corregir estos índices que no nos son favorables. Argentina tiene un consumo muy grande en bebidas azucaradas, alrededor de 135 litros por habitante por año. También se ha producido un incremento en el consumo de alimentos envasados, procesados y ultraprocesados, pero también entendemos que es un derecho al consumidor de establecer rápidamente, claro, para que defina su decisión de comprar o no ese producto. Pero hace nuestro proyecto, nuestra ley flamante, hace mucho hincapié en la educación escolar, en la prevención, en capacitar a nuestros chicos, jóvenes, pero también en el uso de bebidas, de comidas saludables, de alimentos saludables. Se prohíbe la compra del Estado para distribuir en comedores o en colegios que tengan algunos de los etiquetados que puede corresponder. Y también, bueno, se prohíbe el uso de clan, es decir, de campañas que utilicen por ahí superhéroes o dibujitos que promocionen el alimento en estos productos. También aparecen algunas cláusulas como evitar en niños y adolescentes el consumo de cafeína, como también de edulcorantes. Y bueno, en definitiva, es un desafío para la industria de la alimentación, que tuvimos un largo debate con ellos a lo largo de muchos años. Está establecida las penalidades correspondientes, más allá de la que le corresponde por la ley de lealtad comercial a las empresas. Y a partir de ahora, el Poder Ejecutivo, que ya designó la autoridad de aplicación, siempre en nuestros proyectos de ley por decreto legislativo es el Poder Ejecutivo el que define la autoridad de aplicación, es en este caso, para bien de todos, el Ministerio de Salud, y tiene en este caso 90 días para reglamentar la ley y las industrias 180 días para adecuarse, y hay un plazo un poco más extensivo cuando las industrias de la alimentación sean pymes. Así que conocemos los resultados en países vecinos, cómo ha producido cambios culturales. Obviamente que no se puede extrapolar a nuestro país, cada país tiene su costumbre, pero estaremos siendo de cerca una vez que la ley esté reglamentada y aplicada y la ley de etiquetado funcionando a pleno. Obviamente que seguiremos de cerca la evolución de los cambios que entendemos que van a ser positivos para el consumo, para nuestra población, para la salud, y obviamente estaremos dispuestos a compartir estos resultados con ustedes para que tengan una variable más, un parámetro más de un país que logró dar un paso importante como política de Estado en la ley de etiquetado. Muchas gracias.
Mr. Kobos, how inspiring. Thank you so very much. Certainly health starts with good food. We would completely agree. And it's so exciting and interesting to hear that the front of pack labeling is your anchor, which is linked to it other types of regulations like restrictions on health claims and cartoons and promotion in and around schools, you know, and that imperative for action has to be enacted fairly rapidly by the industries. So thank you and congratulations again on such an achievement. I'd certainly like to thank all of our panelists. You've all been incredibly inspiring today, and your interventions have been quite powerful. I'll just note we have run quite close on times. So can I ask that you please, pop any questions in the Q&A, and hopefully
toutes vos questions dans la section
we can
Q&A.
hear the French translation. Pop your questions in the Q&A, and hopefully our panelists will be able to respond directly to any questions there in case we run out of time. I'd like to now hand over to the Deputy Director of Food and Nutrition Division at the FAO, Ms. Nancy Abuto, to reflect on the conversation so far and also the importance of investing in healthy diets, and that this huge opportunity that's ahead of us in a few weeks with the Nutrition for Growth Summit. Nancy, over to you.
Thank you so much, Lucy. What a great set of speakers today. And I thank the organizers for the opportunity to provide these summary remarks, but it really is a tall order with such a rich discussion. Well, what's underpinned our discussion today, all of the panelists, is that we recognize that diets are really a major risk factor for death and disability. We all know the statistics. That's why we were interested in joining today, I imagine. With FAO and UN partners, we publish every year the state of food security and nutrition in the world. And recent reports have really emphasized that we are not on track for meeting our commitments around ending world hunger and all forms of malnutrition by 2030. But we also have the publication coming out this year from the Global Burden of Disease that really emphasized how important diets are to non-communicable disease and death and disability, with poor diets contributing to 6 of the top 10 risk factors and really being a principal driver of premature death. So that's underpinned what we've said today. But we've also recognized for the first time really how influences of good nutrition are coming from food systems, from health systems, but also from things like climate change, from our environment, things that maybe in the past haven't received so much attention. And we're really thinking holistically about what it takes to address malnutrition, what it takes to ensure healthy diets. And ADG Yamamoto started us off this morning with her remarks. One of the very first things she said was recognizing the relevance of the COP26 Climate Summit, in addition to the Food System Summit, and of course, the Nutrition for Growth Summit coming up. Because in order to consider better nutrition, we've got to be bringing in this systems thinking. And I think we've heard that reflected today. Dr. Shunara followed up Dr. Yamamoto right away by, in her very short remarks, she was able to link individuals' interaction with marketing and that effect on consumption, along with food loss and waste. Really holistic thinking. It was really exciting to hear that holistic thinking. And this, of course, was echoed in remarks of other panelists today in the context of school, in food environment, nutrition for the elderly, et cetera. And I think that really is reflecting a global attention to the critical role of sustainable and resilient systems, including agri-food systems for healthy diets for improved nutrition. And this has really never been as prominently discussed as it is today. And discussing it is an important step, but now we need to move to action. So really, good health is underpinned by good nutrition, which is underpinned by healthy diets. And healthy diets are impossible to achieve without robust, fit-for-purpose agri-food systems. So how do we move to that action to make those agri-food systems fit for purpose? Well, we heard today from many panelists lots of options for effective action. And things like public procurement, front of pack labeling, food reformulation policy to reduce trans fatty acids as well as sodium, and more and more. And it's really this systems approach, this system mindset that's providing us new opportunities for catalytic action. Agri-food systems really present a huge opportunity to improve diets. And it's bringing together these individual actions, not only for an additive effect, but really for a multiplier effect to ensure that all the pieces are in place to address food insecurity, undernutrition, and diet-related NCDs by enabling healthy diets from food production to appropriate processing, to healthy food environments, to marketing, to consumer behavior, and to food loss and waste again. So FAO, from our perspective, from the Food and Agriculture Organization perspective, we set out a strategic framework for now until 2031. And it seeks to support the 2030 agenda through a transformation in agri-food systems. It really commits FAO to transforming agri-food systems to be efficient, inclusive, resilient, and sustainable structures that can enable safe and nutritious foods for all. And within that, FAO has a vision for nutrition of a world where all people are eating healthy diets from these efficient, inclusive, resilient, and sustainable agri-food systems. Because measures to increase dietary diversity, to create healthier food environments are required for resilience. And this is necessary to prevent these economic slowdowns and downturns that have happened in recent months with the emergence of COVID-19, for example. We need to keep those from undermining the quality of diets and nutritional status of our people and our populations. So achieving a world where everyone is eating healthy diets can support addressing all forms of malnutrition, of course. And we recognize that many systems are needed. We need good water, we need good sanitation, we need good health systems, education. But the need for strengthening to support better nutrition through healthy diets is absolutely a prerequisite. And as we've touched on today, achieving better nutrition can catalyze progress towards realizing not only SDG 2, zero hunger, but lots of SDGs across Agenda 2030. We've got good health and well-being, of course, SDG 3. SDG 1 with zero poverty, we've talked about support to better development when you have a healthy population based on good nutrition. SDG 5 and education. We've also heard some really inspiring examples today from countries that are taking big action, and this is the most exciting part of what I heard today, Lucy. Japan taking action from the youngest to the oldest in their population. Quezon City in the Philippines acting through this impactful public procurement for healthy diets. Finland reminding us about cross-border collaboration. India linking a food system action and nutrition with social protection, key systems of systems coming together. And then of course, our final speaker from Argentina, hearing about this comprehensive, multifaceted legislation to help support reducing consumption of those less nutritious foods, especially in children. So a final thing that I heard today, Lucy, and then I'll wrap it up is, and I hope that all of you heard this, I heard an urgency that really inspired me. Now is the time. We need to take these actions that we've heard about and accelerate them. We need to be innovative for new responses in emerging challenges. And we really need to look for those win-win-wins across a systems approach for healthy people and a healthy planet for today and in the future. Thank you so much, Lucy.
Thank you, Nancy. What a wonderful energy. I don't feel like I have much more to say myself, but yeah, absolutely. Win-win-wins and urgency are really the messages of the day. And I think I'll add to that leadership and watching what other countries are doing. And so there's no excuses, like we can do it. It is being done, and we need to just sort of pull out all stops to get there. So thank you so much for your comments, Nancy, and all the best in your preparations towards the summit. I know it's a very busy time for you as well. Certainly the event has filled me with a lot of hope that we will actually see health and not just growth on the agenda of the Nutrition for Growth Summit. And we will also hopefully see new commitments from civil society, donors and governments which truly do address malnutrition in all its forms. For civil society, if you need a hand preparing your advocacy or your commitments, we've prepared a guide and we're happy to forward that on to you. Just let us know. The government of Japan has in its priorities for this summit provided a space to really elevate those measures which promote nutrition and health and prevent NCDs through better and more sustainable and healthy food systems. Echoing Dr. Yamamoto's earlier intervention, we implore everyone who's on this call today to seize this moment. We can't afford not to seize this moment. Millions of lives are actually counting on this summit and making the right to healthy food for all a priority. We encourage civil society to make commitments to promote the solutions we know work to promote healthy diets, to monitor and call out those poor practices of the industries that are getting in the way, to hold those to account that make commitments, and to support and celebrate the nutrition leaders like those we've seen here today. And we implore more leaders to protect the health of all with better policies, which are themselves protected from conflicts of interest and harmful influence, to invest in tried and tested measures and innovative policies like we've heard about today, to stay strong and be determined and tenacious nutrition leaders, and to help protect our health, just like we've heard from other leaders today. Finally, I'd like to close this event by thanking our co-hosts and sharing some inspiration for some brave and strong leaders who are stepping up with new initiatives, actions and investments proportionate to this massive challenge that we're facing. The new short video we're about to show you from NCD Alliance and supported through our partnership with Resolve to Save Lives highlights some courageous leadership of local governments in Mexico, who last year introduced a new law to protect children's health from ultra-processed food and drink. Please watch it, please share it, and please be inspired and commit to act on NCDs for this Nutrition for Growth Summit. Thank you for your time.